I'm Christine Jenkins. I'm the international correspondent with Spectrum Women magazine, and I'm here today with Dr. Isabelle Hénault, a sexologist and psychologist at the Clinique Autistic Asperger de Montreal, which is the Montreal Clinic for Autism and Asperger's.
Exactly.
Welcome.
Thank you very much.
Lately, you've been diagnosing a lot more women in the last few years at your clinic. Do you see a rising rate of women in your practice?
Oh yeah, definitely. I would say that years ago, we used to have 4 or 5 males for a female coming for either diagnostic purposes or services. Now we see equal numbers of male and females coming for especially diagnostic assessment. One of the main reasons is we now use some different tools and questionnaires that have been designed for the female profile. So it changed the entire story. When a woman goes online to search some information about autism Asperger's syndrome, she used to find a lot, but about the male profile. So many of the women coming to us were saying, I can see myself in maybe half of the traits, but I'm now confused. But now that we have all the guidelines for females, we've been having a huge, I would say numbers of requests. And I find it fascinating. On a daily basis, when I work at the clinic, now myself, I have the same numbers of male and females coming. So that's just amazing.
You also work with couples.
Yes.
And their relationships. Would more of them be female, neurotypical, and male on the spectrum, or is it changing?
It's changing slowly, but since the females we've been working with, the time they get the diagnostic assessment is quite recent. Some of them are not necessarily in a relationship, but they're looking for a partner. So they can come to us, even if they're not in a practical couple at the moment. We will discuss strategies, communication, intimacy, and sexuality, definitely. We've seen also an increase of number of couples coming to our clinic in their 20s, 30s, and I find it fascinating because they come to us and they have some very specific needs. They say, okay, tell us how to be more intimate together, or we need some conflict resolution strategies. So with some of my colleagues here today, we present some group activities. We have so many couples coming lately in the last 4 or 5 years that now we see them in groups. So they can learn from each other, they can share, and also it's a way to break the isolation.
So there is a different profile for the females.
Definitely, yeah.
And do you find that you have to teach things like informed consent or safety more to these women because they're more vulnerable?
Yes, yes. In our experience, and I would say in the literature, this is what we find. And I'm saying it with, of course, a lot of respect. It's not a criticism, but some women on the spectrum can be quite naive because they have good intention. And they would never think that someone could have different or bad intentions.
So a predatory
motive. Exactly. And I think it's also part, not entirely, but partly due to theory of mind abilities. If I'm a good person and I have good intention, it's hard for me to understand that someone could harm me. So some of these women can be naive, so we teach them about consent. And this is a new project we have at the clinic. We've been using some questionnaires. There's a specific tool coming from the Young Adult Institute in New York. It's about informed consent. It's a tool, it's a questionnaire with role-playing situation, and it comes with a video where you have different situations that you can look at, and you start to learn about decoding what's okay, what's not okay. And what I like about this program that is very, very important for females is we teach them to give consent, and we teach them to ask consent. So it goes on both sides. So
it's progressive, right?
Exactly. We see it, and we work with the tools over usually 4 or 5 sessions, and we've seen a lot of improvement in, being aware of first that someone could have different intention. Because now with the world of autism, and then we see internet information, everything is there, and I wish for females and males as well. But females, I think, are more vulnerable. When they go online, they can navigate in a safe way.
And how to tell which sites are giving true information.
Yes, yes. So we have a list of websites that usually we could recommend to say this is safe, be careful with maybe this type of information. So it's an interactive program where we go online with females and say be careful with this, this, this. So you learn to read the signals that this could be harmful or this type of situation could lead to other consequences. So it's very practical work that we do.
You have some future plans. You've been working with Tony Attwood again. Can
Yes,
you tell us
yes,
a little
yes.
bit what's coming?
Yes, we're working on sexuality and the law since we published a book about
Nick
Dubin.
Right.
We've been training some professionals, especially in the United States, in the law field. We work with students who will become eventually lawyers and judges to teach them about the autism profile. So when they work with someone on the autism profile, they can eventually see the different traits and see the triggers. So that's part of the work we do, and we also are finishing now a profile on female categories. So we should be publishing the document within probably the next 6 months. It should be quite interesting. So it's going to be, I would say, a combination of different questionnaires, traits, and it's going to be a clinical guideline, how to diagnose females on the spectrum.
And you said you had another book.
Yes, exactly. Sorry. Yes, I'm also working with a female with Asperger's syndrome. Her name is Annick Martin, and we just got a contract. We're so excited. It's from Paris, and we will write a book on the female profile. It's in French for first, and of course we'll push to have an English version. It's going to be called "Êtes-vous une aspie qui s'ignore?" So, are you a female aspie without knowing it? So it's going to be very hands-on.
Oh, signor as in signore.
Ignorer. Ignore, yes. So do you ignore that maybe you're one of them? So it's going to be very practical, hands-on.
So would older women get something out of that? Is she middle-aged?
She's middle-aged, exactly, Annick, and she will talk about her
late diagnosis?
Yes, that's exactly, like 2 years ago.
Yeah, exciting.
And we will have also some very practical example of different females on the spectrum. I'm going to be more of the clinical, I'm going to bring the clinical aspect and professional aspect, and it's very exciting.
And the publisher is?
Le Duc. In Paris, Le Duc in Paris. So that's coming as well.
Excellent. And I guess we'll be hearing in the lectures, but do you have any tips for people who one or both spouses are on the spectrum for living together? Like
yes.
Any secrets?
But nothing's magical. But the first thing is accepting the diagnosis is the key. Because when you know about the diagnosis, you can seek for help support strategies. When people are in denial, that's usually the first step that we will try to breach or work. The second thing is, I'll talk about this today, when we think about relationship, I think we should start to think about different types of relationship, not necessarily in a traditional way, because adults on the spectrum may want to share, their life together, but they don't necessarily have to live together 24 hours a day, and they can, have what I call accommodation.
So separate rooms?
Separate rooms, sometimes even separate apartments. They meet for quality time. We work a lot with conflict resolution, mainly geared to communication. I know today the couple will discuss this exactly in practical ways, and that's also something that I really want to share. And my bit will be on sexuality and intimacy. We'll talk about also sensory issues. That's something we need to take into account, especially for women on the spectrum, where it can be tactile,
yeah, especially.
Smells,
auditory,
being close to someone. So I will give some tips today in how to desensitize yourself in an erotic way. Right? Should be interesting.
Thanks, Dr. Hénault, very much.
It's my pleasure. Thank you, Christine.